although most common in teens, it certainly can extend into adulthood. Particularly in the female population, we see a lot of adult female acne, but the reality is it's very common. 9 out of 10 people will struggle with acne at some point in their lives. So we see all kinds of different acne lesions. So there are non-inflammatory lesions, so what we think of as blackheads and whiteheads, and those are called comedones. A lot of other types of spots, such as inflammatory papules, pustules, and even those deep cystic tender nodules or acne cysts. So acne can occur other places than just the face. We often see it on the neck, the chest, the back as well, even shoulders. Sometimes when I think about acne on the chest and the back, particularly in active teens, I think about how sweat and occlusion play a role in acne. So thinking about those uniforms right after sports practice, hanging out with friends, we always want to make sure we shower right after. If we're not able to shower right after sweating, make sure you wipe down with a gentle cleansing cloth. So acne is not just seen in oily skinned individuals. Oil production plays a role in acne, so there's some truth to that, but we see acne in dry skin, combination skin, oily skin, and that's because it's not just oil that causes acne, there are other factors at play. So there are 4 main factors that contribute to acne, the first being abnormal keratinization, oil production or sebum production, bacteria on the skin that flourishes particularly in the oil production, so that's called P. acnes bacteria, and inflammation. There are a number of triggers that can make acne worse. And there are some common ones that we think about, so stress can certainly make acne worse. Some hormonal triggers can make acne worse. There are certain medications that can cause acne to flare. There are certain cosmetic products that can trigger acne, so that's why we always will counsel you to do oil-free and non-comedogenic products if you're acne prone. Even hairsprays and hair products getting onto the skin can irritate the skin and cause acne. Mechanical factors can also contribute to acne. So in the past, we have always seen, helmets or chin straps can cause acne to flare, and now we're seeing that with masks. Another potential trigger is diet. There's a lot of conflicting evidence out there regarding diet and acne. One thing we do know is we want to avoid a high glycemic diet. So you want to avoid a diet that's consistently high in processed foods and sugars. We also want to avoid whey protein in anyone that's acne prone. There is evidence that whey protein can cause acne to flare. So a piece of pizza or a piece of chocolate is not going to cause an acne flare. So a consistently high glycemic diet, so consistency of eating foods like that can cause acne to flare, but those foods in moderation are not a cause of acne. I have a lot of young people come in and they believe that tanning clears their acne, and tanning in general damages the skin. Short term, it can produce some drying effect that can sort of temporarily help improve the look of acne, but after the fact, you can get actually increased oil and flares and breakouts after that temporary fix. And the sun damage that you end up with is long lasting. So I counsel these folks to avoid tanning to try and treat their acne. So we have a wide range of treatment options for acne that can range from just gentle, consistent skincare regimen to medicated topicals and oral medications. Treatments can also include facials, extractions with an esthetician, even some light treatments. So a consistent, gentle skincare regimen is key for acne-prone patients. A great starting point is washing your face twice a day with just a gentle cleanser. And then anytime after sweating is a good idea as well. You want to avoid anything that's going to be really abrasive. So I often see problems with folks who over-exfoliate or over-scrub. You can just use a gentle cleanser and use your fingers, because a washcloth can actually irritate the skin when you're rubbing. In general, another tip I always give is making sure that your products are oil-free or non-comedogenic, meaning they're not going to cause those comedones or clogged pores. We've got a number of great skincare products for acne-prone skin here at our skin store. I also often recommend just the gentle cleansers that you can get at the drugstore, Cetaphil, CeraVe are great gentle lines that are affordable and easily accessible. So there are a number of medicated washes that can be purchased over the counter. A great starting point is tried and true topical wash called benzoyl peroxide. This ranges in strength from 2.5 to 10%, with the 2.5% being more mild, the 10% being stronger. This has anti-inflammatory and antibacterial properties. It can be drying, so it's best paired with a good oil-free moisturizer and a sunscreen, of course. There are also some at-home masks and things like that we can do to help calm acne lesions and prevent new acne from coming up. We can help control acne and we can help with scarring as well. If you just have some general questions about acne or whether it's time to see a dermatologist, feel free to send us a message here. Or you have acne-prone skin that is not responding to just a gentle acne-prone skin regimen. If you're getting acne that is scarring, it's probably a good time to think about scheduling with us. You can schedule an appointment on our website, or you can give us a ring and get scheduled for a consultation.